Welcome, this is Dr. Scott Munsterman here with ChiroArmor, and we are going to talk about prevention strategies for the coronavirus. There's a lot that we need to know and that we need to understand right now today as we move forward into this whole new world that we have here over the next few months in regards to infectious disease prevention and control. And so the majority of our conversation today will revolve around the latest, and I mean the latest over the past few days, information from the World Health Organization and from the Centers for Disease Control. And as we think about infectious disease control, we have to think about it from a couple of different perspectives. Number one, from the occupational exposure perspective, which under OSHA defines that as reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that could result from the performance of an employee's duty. And so as healthcare workers, we have to think about how do we protect ourselves. And we're going to focus on that in this module, as well as we think about our patients and what we can do to help them understand what is going on so that we can eliminate some fear and replace it with knowledge. And that is the key behind this module and the key behind what we do as healthcare providers. And of course, reasons to learn about the coronavirus outbreak. It was declared a public health emergency of international concern just a few short days ago, March 11th. And was officially declared a pandemic. And of course, this active link, will bring you right into the dashboard of the CDC, which gives you up to the minute information in regards to exactly what the numbers are. And as of March 12th, 2020, World Health Organization reported almost 125,000 confirmed cases and about 4,600 deaths. And when you click on that link, just to show you, you can see now, as of this recording, we are at 164,000 confirmed cases and 6,470 deaths. And this brings you a real live situation as to exactly where we're at. And so it's a good piece of information, a good link for you to keep on hand as you keep track of what's going on and how quickly this is spreading. While, as we know, the COVID-19 is the infectious disease caused by the recently discovered new coronavirus. Several coronaviruses are known to cause respiratory infections in humans, and of course this new virus and disease were first unknown before the outbreak began just a few short months ago. And of course, how it spreads is person-to-person transmission through small droplets from the nose or the mouth, objects and surfaces contaminated with the infectious body fluid can also cause spreading. And it's important to understand that the incubation period is anywhere from 1 to 14 days, with 5 days being the most common. Now, the sneaky thing about this is that somebody can be contagious and not be symptomatic. And of course, the most common symptoms, as we talked about this, are fever, tiredness, and a dry cough. The lesser complaints are aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. And of course, the symptoms are usually mild. They begin gradually. About 80% of the people affected recover from the disease without needing special treatment. And 1 out of 6 people who get COVID-19 become seriously ill and develop difficulty breathing. Older people and those with underlying medical problems, which we'll talk about in just a few minutes, but particularly high blood pressure, heart disease, diabetes, chronic respiratory disease, and cancer, are more likely to develop serious illness. And about 2% of the people with the disease have actually died at this point. People with fever, cough, difficulty breathing should seek medical attention. And so some of the early warning signs for COVID-19, and keep this in mind again as we begin to look at the clinical assessment: difficulty breathing or shortness of breath, persistent pain, pressure in the chest, new confusion or inability to arouse, and then bluish lips or face. And these symptoms, if you do see patients coming in with these symptoms, or if you have these symptoms, it requires immediate medical attention. And so let's move on to thinking about, how do we assess patients? Well, first of all, those three common symptoms, fever, cough, and shortness of breath, are three questions that we need to be asking our patients. We need to be checking their temperature. We need to ask them about if they've had a cough, or if we're noticing that they have a cough and or shortness of breath. And of course, if this is something that you are picking up on within the clinic, and you have somebody that is suspecting or that you're suspecting could be infected, number one is referring them on for further testing of that condition. If you are going to treat that patient, then making sure that you have yourself protected, which we will discuss here shortly. And of course, we're going to talk a bit about the community and what's your experience within your community during this outbreak, and what level of attention should you be heightened to, if you will. But again, looking at their body temp, respiration, observing them, asking them questions about their travel history. These are some of the preliminary types of questions and assessment to work through your clinical assessment process with each and every patient, whether they're a new patient or a patient that you are treating. So how do we protect ourselves? How do you protect yourself from this situation at this point in time? Well, the World Health Organization recommends the use of masks for people who have symptoms of COVID-19 and for those caring for individuals who have symptoms, such as cough and fever. And the use of masks is crucial for us healthcare workers and people who are taking care of somebody, whether it's at home or within the practice. And so, again, by that early assessment, that clinical assessment of the patients, identifying again if they have a fever or if they have a cough or their shortness of breath, that's certainly good indications that we need to take precautions upon ourselves to make sure we protect ourselves with the use of masks. Other ways that we can protect ourselves, and it can't be understated that we need to regularly and thoroughly wash our hands with soap and water or an alcohol-based hand cleaner. In between patients, maintain at least a 3-foot distance from anyone who's coughing or sneezing. You've heard of the 6-foot social distancing distance. Again, a very important parameter to keep in mind as we're out and about. And of course, when we're with patients, we can't treat patients 6 feet away. And so we have to take precautions on understanding that clinical assessment aspect of it. Are we at risk? Are they potentially infected? And then to be able to work from there. Avoid touching your eyes, nose, and mouth. Again, this is a great preventative strategy that keeping your hands away from your face is so important. Following good respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Disposing of that used tissue immediately. Cleaning surfaces with disinfectant. Cleaning the tables. Before and or after every patient use, making sure that you disinfect anything that patients typically touch, like the countertops at the front desk. Regularly disinfecting the place is very important at this stage of the game. And then, of course, avoiding unprotected contact with farm or wild animals. And keeping in mind that you have patients that need to know that and understand that as well. And just upping our game on the infectious control measures like we're talking about today. Towards the end of this module, you will be provided with a download of an infectious control policy. And of course, it states much of what we're talking about here right now as to how we can go about curbing that impact of that infectious process from ensuing within our clinic facilities. If you feel unwell, stay at home. If you develop a fever, cough, difficulty breathing, of course, it all applies to us as healthcare providers just like anybody else. And then staying informed on the latest developments about COVID-19. The Center for Disease Control, World Health Organization, and the links that we provide you within this module are great ways for you to keep up on what's going on within the COVID-19 situation. And of course, treatment for COVID-19, there are no specific antiviral treatments or vaccines currently available as of this publication. And so people with COVID-19 should receive supportive care to relieve symptoms. For severe symptoms, treatment should involve care to support vital organ functions And then people who think they've been exposed to COVID-19 should contact their healthcare provider immediately. So it's something that we need to be aware of. We want to early identify it. We want to protect ourselves in the process. And of course, if we do run into patients that are infected or that we believe could be infected, making sure we make that referral at that point in time. So some of the patients that are at high risk are those patients that have comorbidity types factors, blood disorders, chronic kidney and liver disease, those that have a compromised immune system, those that are currently or a recent pregnancy in the last couple of weeks, endocrine disorders, metabolic disorders, heart disease, as we've mentioned before, lung disease like asthma or chronic obstructive pulmonary disease, and then of course neurological or neurodevelopment types of conditions. These are the people that it impacts the most severely are those folks that are at risk, and those are the ones we want to be especially aware of. So what do we recommend for patients or for anybody for that matter if they are sick with the COVID-19? Well, stay at home except to get medical care, avoid public areas, and avoid public transportation. And so yes, it's pretty much a lockdown, and that it needs to occur if you have symptoms of COVID-19. Staying away from others as much as possible. So within your home, staying in a specific room, use a separate bathroom if that's possible. Limit your contact with pets and animals. If you're going to be visiting a healthcare provider, calling ahead before you visit your healthcare provider, wear a face mask if you're sick. If you're caring for others, you should not stay in the same room with them, and you should wear a face mask if you're entering a room with the person who is sick. So if you have somebody in your household who has the virus, make sure that you protect yourself, much like we've talked about already. Covering your mouth and your nose with a tissue when you cough or sneeze, and throwing that tissue away in a lined trash can is very important. And then, of course, again, can't overstress enough washing hands. Immediately washing your hands with soap and water for at least 20 seconds. And if soap and water aren't available, then, of course, the alcohol-based hand sanitizer with 60% alcohol content is recommended. And avoid touching eyes, nose, and mouth with unwashed hands. All individuals should limit their community movement at this time, and we'll just have to adapt to the disruptions in those routine activities. We're seeing school closures, some work closures, some work environments are allowing people to work at home. We're seeing a number of things come out now, and we'll continue to see that occur here potentially over the next 4 to 8 weeks. And of course, be looking for any guidance from local officials within your community or your region of your practice. So let's consider some clinic policy options here that need to be looked upon from a clinic policy perspective. And of course, this is based on the level of community transmission. And so if you currently have within your community none to minimal cases, what's recommended here by the World Health Organization and Centers for Disease Control is to provide your workers within your clinic with training, which is what we're doing today. Make sure that you provide and have available access to personal protective equipment, which would be the masks and the gloves, and to train them on the use. Assess your visitor policies. When patients come in, many times, of course, they bring family members or friends or whatever, and they sit in the lobby. Well, assess that, and it may be at the point where it's just patients that come into the practice, or those that may need direct assistance to help them in, but certainly limit and consider limiting at this stage of the game your visitor policies. Encourage your workers, your healthcare workers there, your staff, to stay at home when they are sick. And of course, in conjunction with local health departments, identify exposed healthcare workers, monitor, keep the work restrictions on until they've passed through the healing part of that virus. And then implementing triage prior to entering facilities to rapidly identify and isolate patients patients with respiratory illness. And so, again, it goes back to understanding those most common symptoms and the fever, and of course we can do body temps when patients come into the office. You're recognizing that they're coughing, or they have shortness of breath, or if they've had, depending on their travel. These are questions that we can ask patients even as they call in for appointments. We can begin to ask them if they have any of those types of symptoms, so that we know if they are potentially could have the COVID-19. If your community is experiencing minimal to moderate type impact from the COVID-19, implement changes to visitor policies immediately. And again, just like we talked about, you want to limit exposure to your workers, to other patients, and of course this could be looking for symptoms within the clinic. When they come into the clinic, there, taking their body temp for sure, and of course checking for your visitors as well, limiting that visitor movement within the facility. It's all about control and containment, and so make sure that you begin to heighten that impact. The minimal to moderate exposure, if you've got cases that are reported within your community, and depending on how big your community is, if you're in a large metro area versus a rural community, you need to make that judgment call. But certainly to pull the trigger on being more aggressive or active towards this is in everybody's best interest at this time. We need to contain that virus and contain those folks and control as much as possible. And of course, monitoring your personal protective equipment supplies is important, and making sure that you do provide that and have that availability for you and your staff in the event that you do need to treat somebody that is infected. And of course, if there's substantial community transmission, restricting, limiting visitors, identifying the areas of the operation that could be subject to ways that you could deliver care differently. That gets to be quite difficult if that's the case in the chiropractic practice, but making sure that you protect yourself by wearing a face mask all the time would be a very important part of your control plan within your clinic if you have that level of community transmission that is substantial in that respect. And so heighten your awareness in the safe work practices. And of course, as we talk about safe work practices, again, when we talk about personal protective equipment, we're talking about gloves, we're talking about face masks. And when you do use gloves, let's say to clean the disinfected in your disinfecting tables, and maybe there's some body fluid there that you're cleaning up, make sure that you are using gloves, number one, and that your hands must be washed after removing your gloves. You may think that, well, there's no way I could have gotten anything on my hand. Well, the point is that we're being doubly careful by doing that, and that is a CDC measure to make sure that you wash hands after you've used the gloves and removed the gloves, even if they're not visibly contaminated. And of course, disposable gloves should be replaced as soon as possible. You should be throwing those away, and then of course thrown in a lined container, garbage container. Hand washing, again, can't be stressed enough. Both antiseptic hand cleaners, but the best is washing your hands with soap and running water as soon as possible, and for that 20-second time period, and rubbing your hands. That is the most effective way to wash your hands. And then disposing. We talked a bit about this. Personal protective equipment disposal, like when the masks are done being used and the gloves are done, of course, getting thrown away. You're going to be throwing them away into a bag. Now, OSHA requires that bag is labeled, because what you're putting into that bag, into that garbage container, is what's called regulated waste. And that regulated waste could include or have the potentially infectious materials, body fluid, that type of thing. And so it's important to treat it as regulated waste. And how we dispose of that, of course, is to make sure that container is labeled either with the biohazard label or that it is a red bag. And then that tells everybody that there is infectious material within that bag, and then just go ahead and you can dispose of it as you normally would in the garbage. And again, the warning label, it's a universal biohazard label, and that should be utilized on your bags, or a red bag also is a key identifier. And then also laundry. How do we handle laundry? If you've got towels that you use or patient gowns that you use, making sure that you handle that laundry as little as possible with a minimum of agitation. If there are body fluids on the laundry, or the material, whether again it's a gown or a towel, making sure that that gets put in a red bag so that whoever does the laundry knows that that's contaminated or potentially contaminated. And then that individual who is doing laundry, whether it's an outside service or if you're doing it in-house in the clinic, that you handle it as little as possible, agitate it as little as possible, and then of course go ahead and clean. Now we've got a couple of policy downloads for you for your clinic that summarize much of what we talked about here in this module on the COVID-19. These are downloads. If you're a ChiroArmor client, you do have these within your compliance manual, and you'll be able to follow that. If you are not a ChiroArmor client, you certainly can download these training module. This has been Dr. Scott Munsterman. I want to thank you. We will keep you updated on the COVID-19, any changes. Other than that, it's going to be important to follow the compliance towards office policy and national policy in regards to the COVID-19 situation. More to come. Thank you for listening.